So to start out with, I want to ask a question, I guess geared at, probably best geared at Dr. Kelly about nutrition. At the end of Dr. Selleck's presentation, we heard a little bit about nutrition and how that might play a role in terms of environmental interaction effects with all kinds of health conditions, including autism. So I wonder if you could tell us more about, tell us a little bit more, Anne, about what has nutrition got to do with all this?
Is my mic? Yeah, I'm going to start. I'm a pediatrician, so I have nutrition talks with families ad nauseum, as you might know. And we talk a lot about you are what you eat. And when I used to have that conversation, I would say that you need to eat more green vegetables, you need to have more colors in your child's diet. Now I realize I've had to change that approach. I say you have to make sure that green is a broccoli and not a screaming green yogurt in a tube. What you eat has changed, and it does affect behavior, it does affect growth, does affect focus, attention, and learning. There's a natural experiment almost, that happens every year in October called Halloween. How many teachers are there in the audience? I mean, just ask teachers. They think there should be a week's vacation after Halloween. The experiment is artificial dyes, colors, sugar. It affects children's behaviors. We all know that. It's common sense. So nutrition has a lot to do with it. It has a lot to do with children's abilities to, I think, focus, attend, learn, and grow. And so when we talk about children and children with autism, we have to remember children with autism are children first. Some of the things that affect children with autism are things that affect typical children, and diet is one important factor. I think that parents themselves have observed that their children with autism have very selective diets. Many will only eat white foods. Some will crave sugar or crave dyes. Often parents report that their children with autism eat no vegetables and no fruits. So as a pediatrician, I think, and it's an area where pediatricians can have an impact. We can begin to work with families to alter that diet, to improve the nutritional quality. And while that sounds simple, it's not. Often the children with autism have oral aversions and refuse to eat textured foods or foods of different taste and flavors. So it's very challenging for parents to undertake a healthier diet. That doesn't mean we shouldn't try to do that. And I think it's also important for people who are working with these children to help the families achieve that goal. I'll have families tell me that they're trying to either restrict dairy in their child's diet or take dyes and colors out, and then their child is seen by this speech therapist who gives them M&Ms and pudding as a reward. So I think there are ways that we can all help families to achieve better nutritional goals by also supporting what they're doing and looking at our own practices to see if what we're doing is also beneficial. It wouldn't hurt anyone to think about, as a therapist, to think about an alternative to M&Ms maybe as a reward system. So, I think that Dr. Selleck also alluded to the fact that vitamin deficiencies, mineral deficiencies, may contribute to some of the problems of autism. There's much more research that needs to be done in this area, but common sense would tell us that the healthier we are from a nutritional standpoint, the better our outcomes will be for any chronic condition.
Good summary. Thank you for that note. Do others have thoughts about nutrition and how food and diet might play into the developmental course of autism?
I'm Allison Golnick. I'm a pediatrician, and I'm kind of in the trenches being a primary care pediatrician working with families. And I guess one quick thing to address, probably, I think it's even, from parent report, at least over half of children with autism are being treated sometimes with a special diet. So I think it's important to just make sure that the basic nutritional considerations are being covered. So I'm going to just take the most basic one that so many people here probably have heard about, gluten-free, casein-free diet. If a child's being treated with that kind of a diet, there may actually be some real benefits in terms of they're not eating so many simple carbohydrates, which so many of us have too many of, but also you want to make sure that the child is getting adequate vitamin D, which milk is fortified with. Some other kinds of milks, like rice milk, might be fortified with, but that's a consideration to look at in calcium. So from the real ground standpoint, you know, if anyone's going to try to do any dietary intervention, it's important just to look at an overall nutrition standpoint. And also, when we're trying to make that link between diet and behavior, Dr. Selleck alluded to potential linking mechanisms, but I think we don't have that clearly defined for us. So in the meantime, I think what we can try to do as providers to help families is try to help them organize looking at, you know, if they're doing a diet and they're hoping for certain behavioral changes or maybe changes in stools or something like that, you know, to help them actually give them some concrete tools to choose their target behaviors and measure that over time. And also maybe only do one change at a time so that they're able to see those different kinds of changes. So those are some real basic things that when we don't have enough evidence to make concrete links, we can still work with families who are working with kind of dietary interventions.
Yeah, this issue of sort of concrete links and common sense and balance is a theme I think we'll be coming back to a lot. I just want to know how many of you in the theater here are parents or direct providers of kids with autism right now? Raise your hands really high. A pretty high percentage. Yeah, half or more it looks like. What I wonder, Pat, if I could ask you a follow-up question related to these diet issues, how do you advise families to sort of take an intervention that they want to try for a child, maybe one of many children in their family, and put it in the context of the family so that it sort of keeps everything in balance?
This is a big question, I think, for a lot of the families that we work with, and I know there's lots of people working with families and doing great work, and you encounter this all the time because I've met with you before the presentations began. But I think there's three general things that we can do to support the families in looking at the process of which is the best intervention. And having said that, as you introduced me, I do work in a clinical setting, and I think we all bring to the table when we're working with families our own knowledge base, our own beliefs, and our own experience, depending on how many children we've worked with, what kinds of children have come to our practice. But I think the first thing that's very important when you're working with families is to listen to them. And it's very important to listen because, as our esteemed speakers have spoken about this morning, the presentation of autism can be very different. We can have a different level of cognitive functioning. We can have a different intensity of those behavioral characteristics, a different pattern, a different threshold. And we also are faced with this child placed in a family where there might be a cultural context that we might not know very much about. Or it might be a family situation that offers some unique risks or resiliencies. And in a way, it's not the autism that really defines the intervention path that we take. It's really what brings the parent into your setting or into the agency. So when I'm meeting with families, I might hear things like, I haven't slept for 3 months. I'm sleep deprived. Not only does my child not sleep, but I don't sleep as well. Or it might be something like, I wish our family mealtime would go more smoothly. That's the one time of day that we have a sense of family and we have high value on that, but my child doesn't eat and it becomes very stressful. Or it